Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery.
Hi, this is P.J. Ewing. Welcome to the Bee's Knees podcast. Let's take a look at youth and total knee replacement, or for that matter, partial knee replacement. It's something that we're seeing at X10 happen at younger and younger ages, and we're seeing a lot more patients at those younger ages. And it's worthy of a look and just to see, if what we're experiencing at X10 compares well to what's going on nationally and internationally. And thankfully, we've got an article by Erin Rempher, a P.T.A. who works with our company, X10 Therapy, who did exactly that. She explored the issue and did a great blog article and exploration of, what are the trends, what's going on, and are they good or bad, or at least what are the implications? I'll say that right now, in midsummer 2019, we have many patients who are in their late 40s or early to mid 50s, and they're having their knees replaced, one or two, partial or total. So it's very much impacting our organization, and it's great that Erin took a broader look at this to see, if what we're experiencing reflects national trends. And spoiler alert, it does. In fact, there is a trend toward youth and total knee replacement. So I'm going to read through Erin's article right now here on the podcast, and let's see what we learn. In the words of Erin Rempher, hitting your 50s? Time for a new knee. Knee replacement for a younger population by Erin Rempher, P.T.A. and patient recovery coach. What comes to mind when you hear of a person undergoing a total knee replacement? Someone sedentary? Someone in their golden years? Maybe a person using a cane or walker due to pain, instability, and arthritis. We take a good look at knee replacement for a younger population here. The new face of total knee replacement. What if I told you that image has changed drastically in the last decade? The amount of knee replacements for any age has skyrocketed, 120% in the last 10 years, according to the Arthritis Foundation. But even more interesting is that they report 188% increase in people having replacements between the age of 45 and 64 years of age. Comparatively, there was only an 89% increase in those 65 to 84 years old. Okay, here's some good news. There are many good reasons for someone to go through a total knee replacement at a younger age. According to the Cleveland Clinic's website, total knee joint implants had an anticipated lifespan of 10 years in the 1970s. But in recent years, 85% of implants are lasting 25 years or longer. So now, a patient in their 50s may get a replacement and it will be sufficient throughout their lifetime instead of anticipating at least 2 more replacements or revisions. The Arthritis Foundation even cites revisions as being a pro when debating whether to wait for a replacement because revisions are becoming easier. The implant can be switched out instead of removing more bone like during the original surgery. And as a side note, a revision is simply that. When you go back in and make a change, make an adjustment, remove a part, replace a part in a total knee replacement. And I'll also mention that it's very common for the plastic spacer or the plastic meniscus to be replaced due to wear. And that's not that big of a deal. It's kind of what is to be expected when you have a total knee replacement. And if you pop one out and pop one back in, and it allows you to move more freely and continue to wear that joint without breaking the metal and all that stuff, you're in great shape. So the revision surgery is something that really is needed for many people after they have a total knee replacement, and it's much easier to do. Okay, back to Erin's work. CNN and the AARP reasoned that adults are participating in high-intensity activities beyond just high school and college, which creates a larger population of people with arthritis developing after injuries. Further, patients are realizing that they can continue to be active after a replacement and are expecting not to just give up what they enjoy. Patients after joint replacements want to, and often do, go back to playing pickleball, golf, hiking, cycling, dancing, and other competitive sports. The CNN data also shows that over the years, surgeons are more positive that surgery outcomes will be good for patients who can get more use out of their replacement at a younger age before having other health issues. This assurance is likely because of how common the operation has become and the high rates of success. In younger patients undergoing knee replacements, the success rate is between 90 and 95%, states the Arthritis Foundation. Okay, I've got 2 interviews with 2 different patients to share that support the success rates and the point of, it's not so scary to do a total knee replacement at a younger age. First, I've got Jim from Stamford, Connecticut. He had a partial knee replacement in his early 50s after trying absolutely everything. Platelet-rich plasma, injections, you name it, Jim tried it. A very, very active guy, softball and boxing. And got back to boxing after his partial knee replacement. He actually used our X10 machine to recover. The second interview you'll hear back-to-back is from Gayle in Royal Oak, Michigan. She had a right total knee replacement, age 51. She did prehab with the X10, did not do home therapy, did not do outpatient clinic work, simply used the X10 for her recovery, and did brilliantly. Within 2 weeks, the doctor was ecstatic about her results. So prehab and rehab with the X10 for Gayle. Let's listen to those interviews, and then I'll come right back to you.
If you would have asked me if I would have been digging a car out of the snow and mud 3 weeks after knee replacement surgery, I probably would have laughed, knowing what I had been set up to believe the future held for me. Hi, my name is Jim. I'm 53 years old. I live in Stamford, Connecticut. Although I'm originally a New Yorker, I like to bring that to everyone's attention. I have been nursing this knee since a baseball injury for about 30 years. I have done everything that you could imagine. I've had more shots of gels, cortisones. I have had my blood spun in a centrifuge. I found that all these things worked great until I engaged myself in activity again. And it dawned on me that as soon as I got active again, I was right back to where I started. I'm a guy that's not looking to relieve the pain. I'm a guy that's looking to get back in the game. I did settle into a group in Greenwich, Connecticut called ONS. I started with a Dr. Paul Seffi, who was awesome. And he suggested that I talk to Dr. Delos. Not jump into anything, but talk to this great, younger, aggressive surgeon that they had brought in from Hospital for Special Surgery, who was up to date on all the new, latest, greatest techniques. I had the X10 dropped off at my house a few days before my surgery. So I played around in it. I did a couple of sessions in it. I understood it. I have to tell you, it became a focal point of my recovery. I look forward to getting up, getting in that thing in the morning, tracking my progress. I'd make a cup of coffee. I'd put on the news. I'd close the door to my office. I'd sit down in this. And for 30 minutes, and sometimes more, because I would add time to the machine to keep going if I felt like I was making progress and wasn't overdoing it, I was in like this great happy place. It was like being on a little bit of a vacation. Now, it's not all vacation. As you're increasing your flexion and your extension, it hurts a little. It really was a great, great addition to my rehab, and really something I looked forward to doing. I think when I left the hospital, I was at about 30 degrees of extension and about 80 degrees of flexion. After 2 weeks on the X10, I believe I maxed out, and I do have this charted because I was real careful with it. I got to just shy of 130 degrees of flexion and to 0 degrees extension. I really believe that the work that I did got me to a position faster in my recovery. I'm able to get up and drive the car. I'm able to go to work. I have great range of motion. I go up and down the stairs. All these things that were potentially an issue to me. I know that the fact that I was able to create greater range of motion faster got me back to a more normal, everyday life much more rapidly than I would have without it. If you're lucky enough to be in a position where you can get on one of these machines or get to the good doctor and get to good PT people, put in your work, because now it's on you. You have all the vehicles to make it happen.
The X10 has been such an amazing experience for me that if I ever had to have my other knee done, I would absolutely have the X10 as part of my recovery plan. Hi, my name is Gayle. I'm 51 years old, and I had a total knee replacement by Dr. Jems Story 3 weeks ago, and I've been using the X10 therapy 3 times a day, every day, 7 days a week, even sometimes 4 times a day, and I love the X10. It has helped and improved my recovery 100%. I have only used the X10 therapy as part of my healing and recovery process, and I love the X10. I have not done any home physical therapy. I have not done outpatient physical therapy. I have relied 100% on the X10 for my therapy. The X10 therapy machine is very, very user-friendly and very easy to use. Yes, prior to surgery, I used the X10 for everything, for range of motion, for strengthening, concentric, eccentric. What I loved is I could see my progress as I was doing it. The X10 company provided me with a coach. Her name is Erin, and Erin is absolutely phenomenal. From the day that the X10 was delivered, she has reached out to me. She contacts me every day. Anything I need, I can call her at any time, and she will respond and call me. She has really been a huge part of my success. The X10 therapy allowed me to get to my full range of motion in 2.5 weeks. I'm young, and to inflict the manual pain that comes with just manual therapy creates anxiety, because when you can't do it, you get very upset because you feel like you should be farther along than you are. The X10 is super convenient because it's in your home. You don't have to go anywhere. I can sit on it as many times a day that I want. I'm a little over 3 weeks post-op using the X10, and I feel the strength in my leg. I feel it's as strong as when I went into my surgery, pre-surgery. I feel very confident. I feel very comfortable with my strength. Now I can ride my bike. I can get back to strength training at the gym. I do gardening. I can do my gardening without pain. At my 2-week post-op appointment, after I saw Kelly, Dr. Werner asked me to walk for him, and he was extremely impressed by how well my gait and my balance was and the straightness of my walk at 2 weeks. And the X10 is really the reason that I had that great of a recovery and why I looked and walked so good.
Okay, there is also some bad news. Unfortunately, as optimistic as it is to think that only active lifestyles and scientific improvements have caused a shift to younger T.K.A., total knee arthroplasty candidates, one mutually agreed upon reason remains. This is the bad news. Rising obesity, right? And I bet you weren't surprised to hear that. In Erin's words, a study in the Journal of Bone and Joint Surgery supports this, and it is cited as a common cause leading to TKA in articles on the Cleveland Clinic and CNN websites, as well as on many other websites discussing total joint replacement. As weight rises throughout the population, joint replacements are sought out sooner. If you visit the blog, there's a great graph which shows obesity rates in the United States for different age groups for men and women, and you can observe the trends yourself. According to the study referenced by the American Academy of Orthopedic Surgeons, obesity has risen faster in those aged 18 to 64 years of age compared with their over 65-year-old counterparts. The study compares what influenced changes in the recent rise in hip and knee replacements. Both types of joint replacements experienced similar changes in reimbursement, hospital stays, and physicians. The outstanding difference was weight gain. Therefore, it was clear that obesity was the driving factor in the increase in young TKA patients. All right, well, what about you? How do you decide if it's time for surgery? Of course, an honest conversation with your orthopedic surgeon is important, and maybe a number of orthopedic surgeons if you're shopping for your surgeon, as well as other healthcare providers. Talk to physical therapists, talk to friends that may have had this done at a younger age. Get as much information as you possibly can. But the Arthritis Foundation offers a good set of pros and cons to consider on your own. All right, now this is really good stuff, so listen up, everybody. Pros, okay, for you, if you're thinking about this, pros in favor of knee replacement. You will have decreased or no pain after the surgery. There is a 90 to 95% success rate for younger patients. Revisions may be needed, but don't require removal of more bone in most cases. You can stay active in what you enjoy. You are less likely to negatively affect your hip and back because of knee issues. So you don't have those repercussions of a bad knee that start to affect the rest of your body. All good. Let's talk about the other side, the cons, why you should, really think hard or consider putting off a total knee replacement or partial knee replacement. So the cons, recovery time is something that you're going to have to think about. You're right in the middle of your life. You're 48 years old, and you're now going to take 4 to 6 weeks out to have this done. So that can really be compromising for careers and raising children and all that stuff. So it also costs money and really requires a solid commitment. A younger replacement means more wear on the prosthesis, which can lead to damage requiring a revision or other replacement. If you're really hard on that knee, you will need that meniscus replaced, but you also might need the whole thing done over again if you're going to go right back at it with high intensity activities and sports. There is a whole list of sports you probably don't want to tackle. Things that have impact on the knee. Basketball is one good example. So we've got more articles on the website about what you can and can't do if you're curious about that. Of course, another con is that surgery comes with risks. If you don't have surgery, you don't have those risks of infection and other general concerns that come along with surgery. And lastly, you may be able to return to most but not all of your favorite activities. Okay, so it's not like you can just throw in the new knee, rehab it, and go right back to everything, as I kind of indicated before. So in the end, the question remains, should you go forward or should you not? Of course, I can't answer that question for you specifically, nor can Erin, but note that it's more common. It's not a shock to a surgeon for people at younger ages to come in needing the replacement. Also, if this is a worry, but it's not a reality for you and you're overweight, guess what? That's within your control. Lose the 20 pounds, lose the 30 pounds. That weight has such impact on your joints, your current good, happy joints, that you can avoid this decision to go forward with a knee replacement at a younger age if you just take care of those knees and lose the weight. That's the one obvious factor for everyone to consider. So that's the article today. I'm really happy that Erin put that together for all of us. We're happy to answer questions here at The Bee's Knees. If you've got them, you can write us at thebeeskneespodcast@gmail.com. I would encourage you to read the article that Erin wrote, which is on the website, x10therapy.com, and then just go to the blog or just go to the little search magnifying glass and look up younger knee replacement. You'll find the article. It's a great one, and there are some good graphs. And also the sources that I was referencing, that Erin was referencing, those are all listed at the bottom of the article that are worth exploring, those original articles. Thanks for listening. I'll see you again next time.
To learn more, visit x10therapy.com. 1-855-910-5633. Just a reminder, it's a huge help if you subscribe to, rate, and review our podcast. It helps people find us.
X10, back to full strength.